This is our CDC update and COVID roundup for January 19th, 2024. It appears that we have a possible decline in new hospital admissions due to COVID at about a 10% decline, and we have another 10% increase in deaths due to COVID. Grounding this into context, we've had 9 weeks of hospitalization increases due to COVID, with one possible week of decreases. I'll touch more on that later. And then 20 out of the past 24 weeks have involved death increases due to COVID, where the 4 weeks that we didn't have death increases, it was holding constant. What's very interesting is that JN1 now makes up about 86% of all existing variants for COVID. And what really surprised me this week is that we didn't have a JN1 variant breakdown because there are now 4 subvariants of JN1 that make up over 1% of the population. So I was very surprised that this didn't happen this week. Let me show you what I'm talking about real quick. So Raj Narayanan looks at the wastewater scan breakdown and creates these really cool charts. And we've known for 2 weeks now that JN1 has 3 subvariants, and this week they have a 4th subvariant, where JN1.4 has increased from 11% of the variant proportion to 16%. So there is JN1.4, JN1.1, there is JN1.8.1, and JN1.2, where JN1.8.1 just flew onto the scene this week. So that's something to watch. That's what the eyeballs are for. These are ones to watch. And the really important thing about this is with these 4 new subvariants, they can help to stimulate a new surge of COVID. And you can immediately get reinfected with these new variants, even if you just had JN1. From the travel monitoring program, we see that that trend is still the same, where we have a very, very large section of JN1. But what's really interesting when we look into this variant breakdown is that there seems to be a resurgence of BA.2 and then B.1.1.529, which is the original Omicron. So you can see these have been popping up over time here and there, but these percentages when there's a very, very large dominant JN1 is a little surprising to me. And then this is our map of percentage of new hospital admissions due to COVID. As a reminder, anything that is orange is increasing, anything that is yellow is holding stable. This could be stable at high levels, stable at low levels. You have to look at the prior map to know. And then anything that is green or teal is decreasing levels of COVID hospitalizations. So overall, we're seeing a lot of green and yellow. And when we toggle between last week's map and this week's map, the yellow has a lot of overlap. So those are largely areas that are holding at high levels from what we've seen previously. But there does seem to be significant decreases in the percent change in hospital admissions due to COVID, largely across the United States. So then looking to the New York State map, as a reminder, anything that is dark blue is low levels of COVID, anything that is light blue is moderate, and anything from yellow to bright red is high levels of COVID. We're seeing that for all reporting wastewater facilities, that 97% of the wastewater facilities that are reporting right now are at these high levels. It's hard to say what the trend is right now in New York because they've shifted into the second highest and the 4th highest of the high levels. That would be the dark orange and then the yellow. So I'd largely call this remaining stable at high levels. And then shifting over to California, if we look at wastewater scan, for the 58 reporting counties, we see that there are still major increases in COVID wastewater levels, blowing this up. So this indicates to me that we are not yet at the peak. I believe that we are still going to see increases in the COVID concentration levels for the next few weeks still, especially with these new subvariants of JN1. But then looking at New York and California, where the wastewater is showing that it's at high levels, you go, well, then why did the hospitalization level decrease? Well, there might be 2 factors that are playing into this, or 2 known factors. The first is a little scary, is that David Christopher is saying that they're almost out of COVID PCR tests and that they're back-ordered. So it's very possible that people have COVID, they just aren't being diagnosed with COVID because the hospitals are out of these PCR tests to confirm the COVID diagnosis. Ergo, the hospitalizations are not being reported as COVID hospitalizations because the diagnostic tests are not there. Second, Michael Olesen has previously noted a reporting issue for hospitalizations, showing that there appears to be a significant drop in reporting, as reflected in the graph by the red and black dotted lines. So, while not yet confirmed, it's very possible that the lack of PCR testing being available, in addition to this drop in reporting of COVID hospitalizations, could be playing into this sudden decrease in the numbers. And then another thing that's important to recognize is that all hospitals are only required to report COVID hospitalizations through the end of April 2024, so this year in a couple months, where this has been a condition of participation for Medicare and Medicaid services, with the expected end date around April 30th, 2024. But the Secretary of Health and Human Services could terminate this earlier. So when we're seeing the wastewater levels go up and remain at high levels right now in the most reliable wastewater reporting states, that would be California and New York, and we hear massive reports of hospitalizations, and anecdotally I've seen that there are a lot of sick people in a lot of different states, at least 4 that I recently went to through airport travel. This sudden drop doesn't seem to reflect all of these other things that are happening, which in the gut sense makes you think, well, maybe something is wrong with the hospitalization numbers for this week. And these are 3 possible conditions that could be playing into this sudden drop: PCR test unavailability for diagnosis of COVID, this trend of decreased reporting by hospitals, and the nearing end deadline of mandatory reporting for COVID hospitalizations to the CDC.